won't get you jobs unless they're yours.
The procedures that I'm getting done are both rhinoplasty and breast augmentation. I decided to get breast augmentation because I have just always wanted to, and a lot of my friends have gotten it done recently, and all of theirs look really good, and so I've wanted to for a while now.
In her case, she already had a decent amount of breast tissue, so she didn't need a significantly large breast implant for the size she wanted to be.
I decided to get rhinoplasty just because I've always been unhappy with my nose, and so I want it to be a little bit more perfect. I think it would build my self-confidence as well.
Well, for Danielle, she didn't really have a huge nose. She didn't want really significantly large changes, but she had a bump. Her tip was a little wide.
My expectations of the surgery is just to be happier with myself overall and just to be more confident.
The breast augmentation was through an areolar approach. That is, the incision was at the bottom of the areola, and the implants that she decided on using were the saline implants. And this was fine for her because she had plenty of breast tissue, so she has a lot of padding. So the difference between the saline and silicone in her case is going to be minimal.
I decided to go with Dr. Kim because, first off, 2 of my friends have already gone with him, and then secondly, I kind of found him just on the internet, and I was looking at his before and after photos, and then I looked at his credentials, and overall I was happy with him, and so I decided to go through with it with him.
And then for her rhinoplasty, with Danielle, we were just removing a bump and making the tip slightly smaller, so she wasn't an extreme case.
My expectations have been blown away. Dr. Kim is such a good doctor. He's so professional. He's a perfectionist, you could tell, so I really trusted him, and everything looks very natural. I'm really happy with the results.
And subsequently, I think because she already had some extra breast tissue and the skin wasn't very tight, so immediately right after surgery, she was relatively pain-free.
I'm happy with my results, and especially happy with my breast augmentation, although my rhinoplasty, I'm really happy with that as well.
The nose has also healed very well. Noses in general aren't that painful anyways, so once we got the packing out, there was really little discomfort. Every patient's different, but in her case, she healed fantastic, and after 2-3 days, she was ready to go. Most patients can go back to work after 3-4 days after the breast augmentation. And for rhinoplasties, usually they like to stay away from work for about a week just because they have a cast and they look a little bruised. Healing-wise, Danielle did fantastic.
This has changed my everyday life. Not too much. I'm not treated differently, but I just feel better about myself. I have a little bit more fun getting dressed up when I'm going out. And yeah, I just feel better. Generally, I just feel better about myself.
Let's hear it for the great Mr. Hunt.
Your question, are those real? Because
they're 100% real.
Why everybody says they're real and then I touch it
No,
and then they're real?
touch it, I swear to God.
Oh, all right.
I really want to show him that I'm here because I want to find love and I'm real.
Oh, you know what? I kind of like it. I don't know if I can keep going on because otherwise all the girls would get jealous. But it was like a nice American pie, like a soft little pie. Amazing. Like I love it. I guess they're real. Are those real? I want you to be.
No.
If they're fake, you can tell me. I felt uncomfortable with my boobs.
My boobs are fake.
Okay, why did you
But
put
I
it
love
up?
them.
Because we are a little bit concerned about changing the body in Italy. Like, we want natural people.
Yeah.
So,
You wanted your all-American girl, and a lot of
Yeah.
American girls have things.
But I'm real.